Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy channel. Today's class is regarding the Charak Samhita Uttarardha, because the first part has been already over. There are totally, as you know, Sutra, Nidan, Vimana, Sharir, and Indriya. This we have finished in the Purvardha. And now in the second, we have Uttarardha. The most important is the Chikitsastan, because there is a quote in Ayurveda, Charakastu Chikitsite. This you should not forget at any time. And any question you may use this particular quote in between. So Charakastu Chikitsite means Charaka Samhita is the best reference book from Ayurveda if we want to treat the patient on the principles of Ayurveda. So Ayurvedic management is possible when you are master in Charaka Samhita. And then Chikitsasthana is followed by the Kalpasthana and then the Siddhisthana. What has happened in the Chikitsasthana, Charak many times has used the different Panchakarma procedures like Shodhana. Panchakarma is a detoxification. There are 5 karmas. Vaman is a predominantly for Kapha, secondarily for the Pitta. Virechana predominantly for the Pitta, secondarily for Kapha. Basti basically for the Vata dosha. Then Rakta Mokshana is for blood purification, but also it is applicable for the the Pitta dosha, because Pitta and Rakta are the Ashraya Ashri Sambandha. And last is the Nasya. Nasya is basically nasal drops or the nasal medication. And Visheshat Urdhvajatru Vikareshu Visheshat Nasya Mishyate. Urdhvajatru Gata Vikar, Jatru means the clavicle bone. Above that region, if there is any problem, for example, ENT problem, ear, nose, throat, ophthalmic problem, and the neurological brain problem, then the Nasya Chikitsa should be adopted there. Okay. So after Chikitsastan, Charak was thinking, oh, I have mentioned a lot of time the Panchakarma procedures, but I have not discussed too much about the plants which I should use for Vamana, plants which I should use the Virechana. So let us discuss these particular herbal plants in detail, which are useful for Vamana, which are useful for the Virechana, which is useful for the Nasya. Let us discuss. And then he has written the Kalpasthana. Kalpa is a different formulations, recipe for the plants that we are using for the Vamana, basically, or the Virechana. So then what is this Siddhisthana? Siddhi is the last success. If you want to success, you should know the indications, contraindications, and complications of these procedures. Please write it down. Today is the 5th of November 2023. This is the Charak Uttarardha lecture, and today we are discussing Siddhisthana, chapter number 2, Panchakarmiya Siddhi. Panchakarma, as you know, Vamana, Virechana, Basti, Rakta, Mokshana, Nasya. Siddhi means the success. And we want to discuss first, number 1, you write down indication. Where to give? To which patients I can give Vamana? To which patients I can give Virechana? To which patients I can give Nasya? To which patients I should not give Vamana? To which patients I should not give the Virechana? To which patients I should not give the Shiro Virechana or Nasya? So these, and which are the complications if I use wrong instrument, wrong method? What will be the problems? What will be the complications? That are discussed in this chapter 2 of Siddhisthana, Panchakarmiya Siddhi. But if you understand, if you have this much knowledge of this chapter, then definitely you will be successful in Panchakarma. Success, results, you will get the 100% best results when you give Vamana, when you give the Virechana. Okay, so let us start. Panchakarmiya Siddhi. Siddhi is a success. Persons fit or unfit for Panchakarma. Achikitsa rogi. Achikitsa. Chikitsa and no chikitsa. Person unfit for any form of treatment. He should not give any Panchakarma. Who are those patients? So here is a lot of Ayurvedic terminology, Ayurvedic paribhashika shabd. So here you can make an independent dictionary. In your notebook, you can make a table. On the left side, you can write down all the Sanskrit words in the Devanagari script, and in front, you can write down the translation. Please, this is my request. You can make these efforts to write down of your own. For example, these are the typical Sanskrit and the Devanagari script. Chanda. What is exactly Chanda? Who is egoistic. He will not follow the orders of the doctors. That is called as a Chanda. Who is a proud. Proud is a ego. E-G-O. That means I am only the correct person in the world. Who is doctor? What he is knowing about? That is Chanda. Then Sahasika. The person having activities beyond its capacity. Ayurveda said Ardha Shakti Vyayama. But if some person is called as extremist, whatever he do the Vyayam, it's okay. But beyond the limit, that is very bad. Okay. Then Bhiru, opposite, who is very, very fearful. Oh my God, woman. Doctor, please don't do. That is Bhiru. That is coward, fear. Then Kritagna does not feel grateful to the doctor. He will not say, doctor, thank you very much. Thank you. You are a very great doctor. You are having like a God. So I am very obliged. No. What I have paid for you, you have to do it. You have taken 1,000 rupees for Vamana. So I will charge you. I will take you into the court because this is a problem was happened. So don't understand these Kritagna people, that is ungrateful people, and avoid them. Vyagra, have the unstable mind, always moving, lot of thinking, worries, tensions. Don't treat. Sajjana, Vaidya, Nrupati, Dveshta, aversion or aggregation towards the gentleman, physician, and the kings. That means he is very arrogant. He is not what you can say the very soft person and having the good communication. Rather, he is more aggressive and want to make a fear to the in person. Now you can see whenever especially modern hospitals, a little bit mishap happens, that person is a delicate, already having a lot of problems, and by chance he dies in the emergency. The Gunda people, vagabond people, they enter and they break hospital furniture and all these things. They are like the Nrupati Dveshta. So they are not good people. Marana Sanna, who is about to die, don't give him Panchakarma. No. Because Panchakarma is like a, you can say the stressful procedures. It's not easy. There are two types of Ayurvedic treatments. Please write down. Shodhana and Shamana. In our medical practice, I will suggest to begin with, don't go for a extreme strong Panchakarma. No. Better you give the Shamana treatment. Only oral, some medicines, massage, etc. That's it. Don't go for you have opened your dispensary and in the first week, you started to give the Vamana. I think that is not a good policy. Although you are very expert, first, the Panchakarma needs a lot of training. And you have to do by yourself under the supervision of teacher. Otherwise, don't do any Panchakarma in your practice. Especially for Vamana, I will warn you. Don't do it because it causes too much dehydration. And because of the dehydration, there may be shock. And patient may be critical. He has to admit in the ICU. So be careful. Okay. So Maranasan, who is about to die, don't give it. So I think I have forget to mark this because this is what we are doing about unfit persons. Adhanya, who do not enough money to afford the medicines. Because it takes a lot of efforts and lot of medicines. That means if he is not capable of paying, then you can refer him to the government hospitals where there is a free of cost. Is denying means we are not against humanity. But as you are having your bread and butter, you have to run your family. So you are doing this not for charitable. You are also making some money for your family, for yourself. So that Adhanya people can go to the charitable hospitals or the government hospitals. Shraddha Hina, who has no honesty or sincerity towards the physician. Sushankita, who has a very much doubtful people. They always have some doubts in their mind. Better way, make a counseling and then only you can treat them. Okay. So let us start to discuss about Vamana Virechana. First is a Vamana. And then Avamya. For these people, contraindications to give the Vamana, therapeutic vomiting. Madana Phala is the Sreshta. Madana Phala is the best medicine. Okay. But not because it is a little bit invasive and strong procedure, you avoid the weak people, very weak people. by whatever the diseases, and they have the weight loss and Vata predominant Prakriti, severe dryness, they are not good people for the Vamana. Vamana people should be very, very strong, physically, mentally. So, Kshatakshina, which is having ulcers and cavity and tuberculosis, no. Ati Sthula. You will say, just now you have said very stout. Stout is different and obesity is different. Obesity is bad. Ashtau Nindita Purush. Ati Krish, Ati Sthula. No, because they have the less immunity. And you observe when the person is having a fat, not the muscles, only fat, they are looking very big. But power, no power, no power. Physical and mental, no power. That is that problem. So Ati Sthula, Ati Krisha, Ashtau Nindita. This is a separate chapter in Nidana. Everywhere. Okay, Bal, very small children below 10 years, don't give. Vruddha, very old, above 60, above 70. Durbala, weak patient. Shrant, very much tired. Pipasit, very much having a lot of thirst. Pitta predominant. Don't give the Vamana. Karma, Bhara, Urdhva. I am not explaining the each and every word, but some important words I will explain you because it has some significance, how that weakness comes. So, Bhara, Ardhva, that means whichever the patient is traveling too much traveling, carrying a heavy weight, that people are having the problem with tolerance is a problem. Vamana should be tolerated. Okay. Then Upavasa, who is doing the fasting. Then Maithuna, lot of sexual activity, that also makes the weakness. Then Adhyayana, too much learning, too much intellectual brain work. They are also getting the brain tiredness. Then Vyayama, Chinta Prasakta, tensions, Sham, Garbhini, pregnant women, don't give Vamana. Sukumara, very delicate people. Dushchardana, Urdhva Rakta Pitta, bleeding disorders. For example, if the patient is having ulcers in the stomach, gastric ulcer, don't give the Vamana. If it is tuberculous cavity and hemoptysis, don't give. Epistaxis, bleeding from the nose, don't give. Rakta Pitta. Then Asthapita, the person which wants the cleaning of the bowel, that you should not give the Vamana. Okay. So, Anuvasita, that means who basically wants the cleansing from the downward passage, Basti, Chikitsa, they should not be given the Shodhana Chikitsa from the upward track. Because this Asthapita, Anuvasita means those who are having indication for giving Basti or has taken the Basti, you should not give because they are also having the procedure at the downward passage. Rudrogi, cardiac problems, angina pectoris, myocardial infarction, they are not give. Mutra Ghat, problem with the urine, Liha, splenomegaly, Gulma, tumors, Udara, ascites. So all these patients should be avoided because of the less tolerance. Tolerance is not there, weakness is there, Oj is less, immunity is less. Okay, so now we will go further. Now I will move your screen on the left side. Now we are talking about the Vamya, persons fit for the Vamana. Here you can give the Vamana. Here you can give the Vamana. So Vamana basically you write down for Kapha problem. Kapha, let us see. Except those who are unfit or the person suffering from Kaphaja Vikara. Okay. Cough, cold and bronchiectasis, for example. Kas, cough. Shwas, breathlessness. Penis, sinusitis. Prameha, diabetes mellitus. Kushtha, skin diseases. Kushtha is not only leprosy. Rajyakshma, with a lot of congestion. Then Vishapita, lot of toxins who has consumed. Garapita, Mandagani, having the weak digestion because of the Guru property of the Kapha. Annajirna, Visuchika, Alasaka, these are the loose motions type problems. That is basically originated from the indigestion. Arochaka, anorexia, Avipaka, non-digestion. Then Navajvara, Galaganda, like thyroid problems, Shlipada, filariasis, and Apasmar and Unmad. If the problems are because of the Strotorod and Ama and indigestion and faulty metabolism, then you can give the Vamana. Basically, Kapha predominance should be there, no Vata and no Pitta predominance should be there. Now we will talk about the Virechana. Okay. So here you see the not to give the Virechana. Actually, Vamana contraindication and Virechana contraindication nearly same. Basically, principle is that they will not tolerate to get the loose motions. They will not tolerate the vomiting. Because of the vomiting, Vamana, or because of the Virechana, loose motions, the people will get the hypovolumic shock. Please write down this word, very important word. HYPO, hypovolumic shock. Hypovolumic shock. That is dangerous. Less supply, ICU admission, saline. So better way to avoid the dehydration. So weak patients, low weight people, vata predominant should be not given the Vaman or Virechana. Sukumara, delicate, Shatagudha, problem with the anal rectal region, a lot of ulcers or problem. Then Adhogarakta Pitta, bleeding disorder, hematuria, per rectal bleeding. Okay, Durbala, Indriya, sensory organs, motor organs, they are weak. Then Mandagni, that means the fire, digestive fire is less. Niruha Asthapita, that means who has received the Basti. Then Kamatura, very much desire, strong desire for the sexual activity. Ajirna, Madatya, alcoholic intolerance or alcoholic intoxication rather, who has always a patient of taking alcohol. Don't use this Virechana. Admana, then Shalya, some what you can say, the trauma or the ulcer is there. Ardita, facial paralysis, don't give Virechana. Abhihata, trauma. Atisnigdha, atiruksha, atikrura koshta. If your digestion capacity, intestinal sensitivity is not proper, don't give Virechana. Then in Avamya from Shatakshina to Garbhini, whatever we have seen previously, that also content is also applicable for the not giving the Virechana. So usually Vaman and Virechana contraindications are the same. Now, to whom we should give the Virechya, that is Virechana? I have given the 3 or 4 important formulations. First, you write down for Virechana Trivrut Leha, Nishottara. Jam. Leha means jam. Trivrut or Nishottar Leha. Okay. Then we have the 3 tablets. Please write down the names of the tablets in the market. Ashwakanchuki. Oh, difficult. Yes, I know. Please write down, try to write down ASH. Ashwakanchuki. Only single tablet can make loose motions. Only. Or otherwise another tablet I can suggest very little stronger. Ichha Bhedi. Ichha Bhedi. Single name. Ichha Bhedi. And third is a Narach Rasa. Narach Rasa. These are all the Virechana Dravya. Then also there is a Abhayadi Modak. Please write down. Abhayadi Modak. Abhaya means Haritaki. Okay. So either of these, when you go to the Ayurvedic hospital, your hospital, college hospital, or any Vaidya, you please ask them, sir, are you using such medicines? They will say, yes, this is correct. I'm using this one. Okay. So you find out what they are using. Now, to whom give the Virechana? Basically, Pitta problem. Whenever there is a Ushna Tikshna, Rakta Dushti, skin problems, that is an indication. For example, except those who are unfit, that means natural. Which are unfit, we are not going to give the Virechana. Pitta Vikar, then Kushta or skin diseases, Jvara, especially Jirna Jvara, Prameha, diabetes mellitus, Urdhva Rakta Pitta. Here I think sometimes I have given you the basic hint for you. Rakta Pitta, Charak is saying the principle, Pratimargam cha Haranam. Pratimargam cha Haranam. If it is Urdhva Rakta Pitta, that means epistaxis, bleeding from the nose, hemoptysis, bleeding from the sputum, hematemesis, bleeding from the vomiting. So upper bleeding, give the Virechana. And lower bleeding, per vaginal, okay, menstrual cycle excess, then urinary bleeding, then stool bleeding, per rectal bleeding, then give the Vamana. So in Rakta Pitta Vyadhi, the principle of treatment, Prati Margam cha Haranam. Rakta Pitta, bleeding disorders. What is the principle of Charak? Prati Margam cha Haranam. Okay. Next. So here, Urdhva Rakta Pitta, give Virechana. Bagandhara, write down. Fistula in ano. Fistula, Fistula, fistula in ano, An-ano, A-N-O. Bagandhar, Ayurveda has the best treatment. Please write down, please. Kshara Sutra. I have the separate video on my YouTube. Kshara Sutra. In the surgery. Playlist Shalya Tantra. Playlist Shalya Tantra. And there you find Kshara Sutra. So see that video. It's a very interesting. Without operation, Ayurveda can treat the Bagandhar by using medicated thread, which is called as the Kshara Sutra. Okay, but also Virechan you can give. Udara Roga, ascites, peritoneal fluid is there. After the liver cirrhosis, before the liver cancer, you can get Udara Vyadhi. Arsha, piles, Liha, splenomegaly, Gulma, tumor, Arbud, malignant, Visuchika, Alasaka, that is cholera, gastroenteritis, Mutraghat, the problem with the urinary tract, Krumikoshta, worms are there, Visarpa, erysipelas, skin disorder, Pandu, anemic condition, Kamala, jaundice, Netradah, burning of the eyes because of the lot of screen time, Hruday Roga, then Vyanga, acne, Vyanga, Tarunya Pitika, Vispot, Vatrakta, maybe gout or maybe rheumatoid arthritis, Apasmar, epileptic fits, and Unmad, mental, hysteria. So, all in these conditions, you can give the Virechana. Now, we are talking about the Basti. First, you write down the two types of Basti, please. Please write down, going slow and steady. Two types of Basti I have already mentioned, but Anuvasan, please write down Anuvasan, Anuvasan, Anuvasana is equal to, it is also called as oil enema, OIL, oil medicated enema, oil medicated enema, Anuvasana Basti, only oil. Second, Asthapan, Asthapana Basti, that is Niruha Basti. Same. Asthapana is equal to Niruha, Niruha. Same. What is the difference? Anuvasan, only oil. Asthapana, oil, plus decoction of the plants, plus paste of the plant churna. So all mixture, not only oil, that is called as Asthapana. Okay. So we will see Anasthapya, to whom we should not give the Niruha Basti or Asthapan Basti. Those having the lot of indigestion, ajirna, atisnigdha, okay, lot of oil is there, lubricant, stagnation is there. Utkrishta dosha, lot of doshas wants to come from the upward side, don't give the Basti. Mandagani, problem with the Agni. Then Ati Durubala, Trishna, having the thirst, Shudha, lot of hunger, thirsty, hungry. Shrama, lot of tired person. Atikrusha, wet loss. Pitodaka, having some, what you can say, the yellow coloration in front of the eyes like jaundice. Then Vamita, Virikta, those who are having already taken the Vamana or already taken the Virechana, don't give immediate Asthapana. No. Immediately after Vaman or Virechan, don't give Asthapana. Then Shwasa, breathlessness. Shwasa is a breathlessness. Kasa, cough. Hiccup. मराठीमध्ये आम्ही त्याला उचकी म्हणतो. हिचकी बोलते हिंदी में हिचकी. बद्धोदर, that is a obstruction in the abdomen. Okay, total obstruction. Chidrodara, that is a perforation in the abdomen. Jalodara, ascites. Visuchika, cholera. Alasaka, Kushtha, skin diseases. Prameha. In these diseases, better way, you should not give the Asthapana Basti. Now, basically, Anuvasana and Asthapana are for Vata dosha. Anuvasana and Asthapana are for the Vata dosha. Okay. Just I will rectify it. Oh, sorry. Just wait. I'm adjusting the screen. Sometimes the technical issues arises and then there is a problem. Just a moment. I will try to check it out. I don't know why I'm obstructed, but okay. I will try. Yes. Here you can see. Here is a Asthapya. There is some again problem, technical problems. Lot of problems are there. Okay, Asthapya. Persons fit for getting the Niruha Basti. All are the Vata problems. What you have to understand, especially there is two types of the Vata Prakopa. Write down two types of Vata Prakopa. First is Dhatu Kshayajanya, deficiency. Dhatu Kshayajanya, Rasa, Rakta, Maus, Med, Asti, Majja, Shukra. If they are Hinasa, Rasa, Hinasa, Rakta, Hina. You know the Sarata. Sarata examination, first year BMS Kriyashari subject. Quality is not good. Quantity is not good. Rasa is of not proper standard. Rakta is deficient. Hemoglobin is less. Mouse Kshaya is there. Weight loss is there. Okay. That is Dhatu Kshaya Vata Prakop. Then you have to better use Anuvasana Basti. But whenever there is obstruction, Margavarodhajanya Vata Prakop. Margavarodhajanya Vata Prakop, basically Niruha can be given. For example, Sarvanga Vata, neurological problems all over the body. For example, motor neuron disease, MND, motor neuron disease, Sarvanga Vata. Write down MND. I have the separate video. Please check it. Ayurveda Academy YouTube channel. Ekanga Vata. I have the video. Pakshavadha. That is paralysis, hemiplegia. The scientific word is hemiplegia. Then Apanavayu, Purisha, Mutra, Shukra, Sangha. Sangha is obstruction. So whenever there is obstruction, Srotorodha, Asthapan Basti. Bala, Varna, Maunsa, Shukra, Kshaya. So there is strength has been lost, color complexion, weight loss is there, your immunity has been low, then you the Niruha. Admana, Anga Sukti, Krumi Koshta, worms are there. Then Shruddha Atisar, diarrhea. Then Pliha, splenomegaly. Shula, pain in abdomen. Hruday Roga, congestive cardiac failure type of symptoms. Bhagandar, just now discussed Kshara Sutra, fistula in ano. Unmad, hysteria, mental problem. Jvara, fever. Shirashula, migraine attacks. Karna Shula, ear pain. All types of pain in the body. You just write down the organ and Shula. So you will get the marks because the Niruha, this is for Vata dosha. Okay. Then here you can see Vishamagni, Vata problem, Spikha, pelvic region, Janu, knee problem, Uru, thigh region, Gulf, ankle. So all there is you can see Shula. Last word is a Shula. So Shula word is connected with everybody. Shula word is connected to Danta Shula, Nakha Shula, Parva Shula, Asti Shula, etc. Okay. Then Shosha, weakness, Stambha, Antrakujana, Parikartika. Please write down. Parikartika is nothing but the anal fissure. Fissure in ano. And all Vata Vyadhi. Can you see here? This is the most important. All Vata Vyadhi. Okay. We will try to go further to discuss about another Basti. Ananuvasya. Person unfit for Anuvasan Basti. No Anuvasan. Contraindication. Now, naturally, whenever there is excessive kapha in the body, we are giving only oil. And oil, Samanya Vishya Siddhanta, it is favorable for kapha dosh. So, whenever lot of cough, don't give Anuvasana. Please write down. Lot of kapha, don't give Anuvasana. Lot of vata, dhatu kshayajanya, give Anuvasana. So always whenever the question is asked, you give the principle first and then write down this, whatever the diseases you remember, you write down. Otherwise, principle is more important. For the examiner, he will be happy. Yes, he has understood the procedures. Those who are unfit for the Niruha, they are also unfit for the Anuvasana. Then Navajvara, no oil enema. Because Navajvara is because of the Sama Rasadhatu. Jvara is a Sama problem, Amata problem, Ama problem. Okay. Then Pandu, anemia, Kamala, Prameha, diabetes, Arsha, that is a piles, Pratishaya, running from the nose, Arochaka, that is Kapha problem, loss of appetite. Mandagni, Kapha problem, no digestion. Durbalta, very weak. Plihodar, problem with the spleen, splenomegaly, and also ascites. Then Kaphodar, Urustambha, that means very strong stiffness in the thigh muscles. Then Garapita, toxins, Krumikoshta, if there are worms, don't give only the Anuvasan Basti. There you can give Asthapan Basti, okay, with Krumigna Kadha, Auding. Now, where you can give the Anuvasan Basti, who are indicated, who are fit. So, basically, those who are fit for the Niruha, they are also fit for the Anuvasan, especially Rukshata. Whenever there is extreme dryness in the body, Vata dosha, Dhatu kshayajanya Vata prakop, always give Anuvasan. Tikshnagni and Kevala Vata roga. Kevala Vata roga. that we have also in the Nidana, Samanyaja and Nanatmaja Vyadhi. So in Vata Nanatmaja Vyadhi, you can use the Anuvasana Basti. At the moment, you just please write down two words. Samanyaja Vyadhi, Samanyaja common, and Nanatmaja. That means specific for Vata, specific for Pitta, specific for the Kapha problems. They are explained. The numbers are like, for example, 80, 40 and 20, etc. That we are going to discuss afterwards. Samanyaja and Nanatmaja Vyadhi. That is Roga Nidan topic, very important. Okay. Now we will go further for the Nasya. Here you can see. Means no. Here is no. Shiro Virechana. These people are not good to give the Nasya. Ajirana. Obstruction is there, indigestion is there. Then Pitamadya, Pitodaka, Snatashira Shirstatu, Kama Kshudha. That means excessive, what you can say, the sexual activity. Then Kshudha, excessive hunger, excessive thirst, very much tired. Unconscious patient, don't put anything in the nose. Then Shastra, Danda, Hatha, traumatic injury to the head or these things. Vyavaya, Vyayama, Pana, Klanta. Vyavaya is after sexual activity, he is very much tired, Klanta. Don't give Nasya. Vyayama, heavy exercise, beyond the limit, beyond Ardhashakti Vyayam. That is also Klanta, means very tired. And Pana, what is Pana? Yes, drinking alcohol. After alcohol also, you cannot give the Nasya. Navajvara, don't give Nasya. Shoka, tension, anxiety, mental stress, don't give Nasya. Virikta, those who have already been Virechan Chikitsa has been given, don't give Nasya. Anuvasita, those have received the Anuvasan Basti. Garbhini, pregnant woman, no Nasya. Then Navapratisha, very freshly, just now you have a lot of cough, that time you cannot give the Nasya. Okay. Now we will go further. Slowly and steadily, and I will go on the left side, please. Now here, to whom we can give the Nasya? Basically, Urdhva Jatru Vikareshu. Will you please write down this sentence? Urdhva Jatru Vikareshu Visheshat Naste Mishchate. ENT problems, ophthalmic problem, head problem, give the Nasya. For example, Shiro Roga, migraine, Danta Roga, dental problems, pain in the teeth, hypersensitivity teeth, Danta Shula, Danta Harsha. Hypersensitivity is called as a Danta Harsha. You cannot tolerate the cold and hot because enamel has lost. Manyastamba, neck pain, cervical spondylosis, Galagraha, Hanugraha, stiffness in the chin region, in the throat region, Penasa, sinusitis, Penasa, sinusitis, Galashundika, uvula problem inside, Kantashaluk, Akshirog, eye problems, Shukla Roga, Timira Roga, Vartma Roga, all the skin, eye disease, eye ophthalmic problem, Vyanga, acne vulgaris, Upajivika, again the uvula type problem, Ardita, facial paralysis, give the Nasya, Apatantrak, Apatanaka, Galaganda, and Swarabhed, hoarseness of the voice. Now, next we will see time for the Nasya. When to give Nasya? Nasya should be administered in Pravrut, Sharad, and Vasant Rutu. Pravrut, Sharad, and Vasant Rutu. You must remember this Vasant Rutu is very specific because this is a Kapha Prakopa Kala, spring season, March, April month. Okay, Sharad is October heat. Here you have to use the strong Nasya, and here you have to use the soft Nasya, like Ghee Nasya. Okay, during the hot season, when to give the Nasya? It is forenoon. Okay, during the cold season, it is in the afternoon, and during the rainy season, day, when there is no cloud in the sky. If there are a lot of black clouds and all the things is gloomy, then don't give the Nasya. We will go further. Basti Sutriya Siddhi, that we are going to discuss about the administration of the Basti, medicated enema, per rectal. Basti has to be administered keeping in view which type of the dosha is there, dosha prakop, which type medicines that we are using, doctor is using, desha, in which area, anupa, jangala, sadharana desh, that is whenever there is heavy rain, that is called anupa. Okay, and whenever there is a dry, then that is called as jungle area. Then according to the season, you have to see the proper season. Satmya, which type of the treatments are good for the patient and which are tolerable and which cannot be tolerable. Then we have to consider the Agni, Sattva, that is the mind. Then Oka Satmya, which is already been adapted and the patient is aware of that particular thing. Then Vaya, considering the age factor and also the strength, physical and mental strength of the patient. All these factors should be considered whenever you want to give Basti Chikitsa. Okay. Now there is a specific instrument which is called as a Basti Yantra. Specific instrument for medicated enema, that is Basti Yantra, and it has a two parts. One is a Basti Netra and another is a Basti Putaka. Basti Netra is a forward part and Basti Putaka is a bag which is attached to the Basti Netra. Basti Netra, we will see the picture, then you will understand. Basti Netra is a nozzle used for administration of Basti. Basti Netra is made up of in the previous years. Now, very rarely, typical in the South India, on the Kerala, some places they are using typical traditional Basti yantra. Otherwise, many people are using nowadays glycerin syringe, for example, giving the Anuvasan Basti, glycerin syringe. Okay, 60, 100 ml syringe is available and catheter is attached and is given. And in the Asthapan Basti, many are using also the syringe, but better way, the enema pot. Enema pot, modern enema pot is used for the giving the Niruha Basti. Okay. But of course, in some hospitals, even in the central part of the India, Maharashtra or the UP, some typical traditional Ayurvedic hospitals, they are definitely having Basti Yantra. So I think you immediately go to the college hospital and you can check whether you can see this particular yantra, because unless and until you see the traditional Basti yantra by your own eyes, you will not get the proper idea. Okay, so Basti yantra has to be seen personally at your hospital. You always visit to the Panchakarma department of your hospital if you want to learn this Siddhi Sthana well and understand all the concepts. Okay, now we are going further. Oh, just a minute here. Basti netra should have the two rings at the base of tying the Basti Putaka. See, the different words are there. Basti Netra and Basti Putaka. Putaka is like a bag. Okay. So measurement of Basti Netra according to the age. For example, in the 1 to 6 years of age, the Basti, that nozzle should be 6 angula. You remember Anguli Pramana practical in the first year BMS in Kriya Sharira subject. Anguli Pramana is 1 width. For example, this is my finger is anguli, and this is the exact measurement by the measuring tape diameter, that is called as a one anguli praman. It may be in the centimeter, for example, 1.3, 1.4 centimeter. Okay, so 6 angula. Then 7 years, it should be 6 and 1/3 angula. Then at the 9th year of age, 7 angula. Then at the 12th year of age, it should be 8 angula Basti netra. Then 16 years, it should be 10 angula Basti netra. Okay, I think it is sufficient to understand. As the age increases, you can increase the length of that particular nozzle. About 20 years, 12 angula is the maximum size of that Basti netra. Okay, let us move further. First, I will move to the left side and then we will come for the right side. Can you see here? Special features of Basti netra. I'm sorry, I don't understand why this particular. I think better I can do the stop sharing and again try to share. Okay, just a moment. Just hold it. Just hold it. It's not a very problem. Immediately, yes. Now it has gone. Okay. Okay. No, unfortunately, it is coming. Yes, fortunately it has gone. Okay. Special features of the Basti netra. So this figure is very, very important for the examination purpose. You can see over here, special features of Basti netra, medicated enemata. The base of the nozzle should be of the dimension of the tip of the patient's thumb, and the front of the nozzle should be as the tip of the little finger. I think this is all about the traditional information. Nowadays, as I have told you, many people use the glycerin syringe for Anuvasan Basti and the enema part for the Asthapana Basti. But yes, in the Kerala, South India, or in some Ayurvedic hospitals in the Maharashtra state, they are definitely having this traditional instrument. So you must check this instrument at your college in the Panchakarma department. Nozzle should be, this is the nozzle, okay? So this whole part is called the Basti Netra, that is entering into, this is entered into the anal part. Patient's anus, Udadwar in Marathi. For rectal, we are inserting this by application of the oil over there. And here, actually that particular bag is applied, which is called the Basti Puttaka on this part. And there is a quath decoction over here, and that is pushed from here into the anus. Okay, are you getting the base? Okay, nozzle should be straight and smooth. The nozzle has a ring at a distance of 1/4 that of the front, total size from the front, and 2 rings at the base. So these are the rings you can see over here. These are the rings. Okay, next, Basti Putaka. Next is a Basti Putaka. Okay, the bag is called as a, so 2 words, please write down in your notebook, 2 words, keywords. Basti Yantra, the first word. What is the first word? Basti Yantra, instrument for giving the Niruha Basti. That is called as a Basti Yantra. Don't translate machine. Don't translate machine. Instrument for giving the medicated enema, that is Basti, which is the best treatment for Vata dosha. 2 types of Basti, Anuvasana and Asthapana. Anuvasan only oil, Asthapana or Niruha with oil plus decoction plus paste. Now, Basti Yantra, 2 parts. Basti Netra and Basti Putaka. Basti Putaka is a bag or the container of the medicines. The bag of medicines to be tied to the nozzle is generally the bladder of various animals. This sentence is very important, always asked in the examination, always. Why the word Basti? Why we say the Basti? Because previously in the Charak time, olden days, what they do, they prepare this particular bag from the animal skin. Various animals like buffalo or the sheep. Nowadays it is not allowed. Nowadays it is not allowed. If that is not available, thick cloth can be used. Some of the Vaidyas, they use the big plastic bags also. Yes, plastic bags. I think in my Panchakarma, you see the mobile app, Ayurveda Academy. You download it, free download from the Google Play Store, and then purchase the Kerala Panchakarma program. And there you can learn all about this Basti management. Okay. Then features of ideal Basti Putaka, that is a bag, it should be tough because it should not tear. No? If we pour the liquid, if it is breakdown, that is a problem. So it should be the thick, tough, but thin, devoid of the veins. We are talking about now the animals. So devoid of veins, free of the foul smell, have a color of the kashaya, soft and clean. These are the ideal, what you can say, the properties of the Basti Putaka. Okay. Now, Tiryak Pranidhan Adi Dosha in Basti Prayoga. Wrong ways of administration of Basti. Faulty, not correct. The doctor is not trained. The student is not trained. Internee is not trained. Then he makes such mistake. So there may be problem with the instrument, problem with the person who is giving, problem in the method. So all types of the problems can make a complications in giving the Basti. Okay. So if the nozzle is entered, first we will mark and then we will read, because then it is easy. If the nozzle is entered obliquely, this nozzle, which is entering into the Guda, anal region, anal hole, medicines do not enter in a stream. If you wrongly, obliquely, that will of no use. If the nozzle is shaken like this during the entry, shaken, move, then it will cause the vrana, fissures in the ano, all types of trauma will be there. If the container is squeezed weakly, bag is not squeezed, pressing not properly, medicines do not enter into the rectum. If squeezed with force, medicines reach high in the intestine, causing the nausea and vomiting. So not too fast, not too pressure, not too less pressure, moderate. Everything should be moderate, medium. Okay. If medicines used are cold, wrong, because we are for Vata. Vata always require the warm, W-A-R-M, warm. So all the decoction, all the oil should be warmed, or it should be heated in water bath. Please write down. This heating should not be done directly on the fire. No heating of the decoction, no heating of the oil should be done directly on the fire. Wrong. First, there should be vessel with water, and in that water bath, you can keep the bottle of your oil or pot of your decoction. Do you understand? So direct is not allowed. Okay. Then, if medicine is too cold, no therapeutic action is seen, and neither the medicines flow out. If medicines used are hot, causes the burning sensation and loss of consciousness. Very bad. Always check the temperature by putting your finger into the decoction, putting your finger into the oil. Check it. If you can tolerate, it's okay. Even it should be little bit below that, because anal region has a mucous membrane, and mucous membranes are more delicate than simple skin. So when you put your oil to check the temperature should be even less than what you are expecting over here. I think that part is very clear. Okay. Now we will go further. We are talking about the Basti, medicated anemia, procedure, and the complications. Okay. So, my dear friends, if the medicines are very, very snigdha anchas, that can cause the lethargy, because throtorodh will happen. If medicines are very ruksha, dry, that can cause the vata prakop, samanya vishesh siddhanta. If medicines are very thin, in less quantity, with inadequate salt, then therapeutic results will not be seen. If medicines are in excess quantity, that can cause the atiyoga of Basti. 3 words are important. Panchakarma, in Panchakarma. Please write down 3 words. Please write down. First word, Samyak Yoga. Please write down Samyak Yoga. That means the proper effect. Samyak, proper effect. Okay? And then Ati Yoga. Ati means excess, beyond expectation, something goes wrong. Ati Yoga. And another is a yoga, not getting the proper results. That is also bad. So Samyak Yoga is the best thing. Ati Yoga is a bad. Yoga is also bad. Okay. If salt is excessively used, actually in Anuvasana and in Niruha, both little bit of Saindhava is used. Little bit Saindhava. But if it is too much Saindhava has been added, then that can cause the burning sensation in anorectal region and loose motions. That is the diarrhea. Okay. Now we will go again on the left side. Okay. Quantity of Basti Dravya. Quantity. Especially Niruha Matra. For example, in the 1 year, only half Prasruta. This is homework for you. You have to write down 1 Prasruta is equal to how much ml, milliliter. And 1 Pala, how much ml? Please write down and WhatsApp me. This is homework for you. Okay. So 1 Prasruta, 2 years, 1 Prasruta. We will not go details, only 10 years. You can see the 9 Pala or 4.5 Prasruta. Then 10 years, 5 Prasruta, that is 10 Pala. Okay. Then at the age of 15 years, the child is little grown at the school level 10th standard. Then 9 Prasruta, that is 20 Pala. Then 18 to, basically I think you can remember this. These are very important. From 18 to 70, 12 Prasruta, that is the maximum possible dose with the Basti, and 24 Pala. Greater than 70, again like a child, dose should be reduced. 10 prasruta and 20 par. This is the regarding the how much medicines you should take when you are want to give the niruha. Now I will shift the screen on the right side. Process. This is the most important part of today's lecture. Very interesting. In the practice also, this is very important. In the oral also, they will always ask you, definitely, 100%. In the written also, they asked, tell the exact procedure of mixing different contents in the Niruha Basti or Asthapana Basti. In Anuvasan, there is no problem because only tel and little sendava, finish. But here in Niruha or Asthapana, there is a decoction, there is a paste, there is oil, there are salt, there is honey. Let us see how it mixes. Basti Dravya should be mixed in the following sequence. My dear friends, this sequence is a lot of printing a mistake. Devanagari script, bad. But I will tell you if possible by mouth. So you can write, don't write these things. This is wrong. Spelling mistake in Marathi. Devanagari script is not good. First, you have to take the honey. Please write down honey. Madhu means honey. Then add sandhava. Sandhava, salt. So mixed it. Mortar and pestle. You have to khalabatta in Marathi. Mix it. Honey and sandhava. Mix it. Very good, very good. Honey and sandhava. Please write down honey and sandhava. Sir is mixing honey and sandhava. Then add 1 ml of tilatail or 10 ml of tilatail. Okay, getting my point? So I am mixing this and then adding oil, sesame oil, and again mix it. Honey, sandhava oil, honey, sandhava oil, honey, sandhava oil. Mix it. Then add kalk paste, which we have already prepared in another table or on the another part of your table. You have prepared the paste of the herbal churna, mixing with the water and with our what you can say, the grinder mixer, something like that. You have mixed and make the paste. You understand? Kalka is a paste. Then add that kalka and again stir. Again mix it. Mortar and pestle. So I have added sandhava, honey, then tilataila, and then paste. Mix it. And then lastly, can you see here? Vath. So this sequence, then add the 200, 500 ml of decoction. Vath is a decoction. So sequence is very important. It is not like that you have to take the vessel, big vessel, first take the decoction, add little bit salt, add 1 spoon of the honey, little bit oil, give it. No, wrong. It should be homogeneous mixture, good mixture. So that's why I have taken the first honey and sandal, then tilatail oil, honey, sandal oil, add paste, honey, sandal oil, paste, and lastly decoction. Then big spoon and mix it. I hope very much action. So you have definitely understood the sequence, procedure of making the Niruha Basti. Am I right? Okay. To prepare the Basti Dravya for the administration of Niruha Basti, first Madhu, honey is mixed with Sandhava Lavana, and then Sneha Dravya like sesame oil, tail, or ghrita, cow's ghee or medicated ghee, tiktaka ghrita, etc., kalyanaka ghrita, etc., mixed homogeneous. This word is very important, homogeneous. To this mixture, kalka is added and mixed, then vath last is added, mixed and filtered. Filtration is very important. This is filled in that Basti Putaka, Basti Yantra, and used as a Basti Dravya to enter into the anus, anorectal root of the patient. Position of the patient. This is also oral question. We always ask, we always ask, examiner always ask. Basti has to be administered with the patient left lateral position. Left lateral, turn on the left side. डाव्या कुशीवरती वळा मराठीमध्ये. Left lateral. And then you add one thing. Add, please add. Right leg folded with the knee. Right leg folded in the knee and taken to the abdomen. And taken to the abdomen. Please write down. In addition to the left lateral position, right leg should be taken up. Left leg straight. Left leg straight. Please write down. This is not written here. That's why I am dictating. Left lateral, it's okay. But next two steps you write down. Left lateral, it's perfectly all right. Now here, left lateral. But then right leg taken up, folding in the knees to the abdomen. But left leg is a straight. So you can see this picture, Google Images. You can go to the Google Images. Okay. But why to go to Google Images? Dr. Deshpande has shown the video also in the mobile app. So you open that app, see all the video, and you will get understanding. Quantity of the Anuvasan Basti, 1/4 of the Niruha Basti. Usually, routinely, what we do, minimum 60. Please write down. Anuvasana matra in the practice, medical practice. What we do. Anuvasana Basti, oil enema, we take 60 ml to some patient, or 70, or 80, or maximum 100. But maximum times we use only 60 ml Anuvasana Basti, sufficient. But Asthapana, Niruha Basti, we give near about, please write down, 400 or 500 ml. This is the quantity. Because it has a lot of quath, decoction. So it is not only 500 ml oil, it is total mixture. Honey, salt, paste, decoction, and everything. That is called as a 500 to 600 ml for the Niruha or the Asthapa. So, in short, I think it is better that I can go back again to show you what we have learned today. We have talked about the Basti Yantra, Basti Putaka, Basti Netra, procedure, everything. And we have complications, if we give hot, cold, that we have seen. Then Basti Sutriya, 3rd Adhyay, Siddhi Sthana, 3rd chapter, Principles of Administration of Basti. Then what we have seen next, before that, Nastyakara, nasal drops. Then Shiro Virechan is the same. Shiro Virechan is equal to Nastya. It is not separate. Charak has used the Shiro Virechana word for the Nastya. Vagbhat has used the Nastya. Then indications, contraindications of Nastya, of Anuvasan Basti, of Asthapana Basti, of Virechana, of Vamana, that everything we have discussed. And in the beginning, we have also discussed who are the people are totally should be avoided to give the Panchakarma, any procedure like these people, achikitsarogi, unfit for any type of the treatment, like Chanda, Sahasika, Viru, Utagna, Vyagra, etc. Maranasanna, Adhanya, Shraddhayana. So, my dear friend, this is all about today's lecture, Charak Uttarardha, on the 5th of November 2023. We will meet on the Monday. There are 2 lectures on the Monday, one in the afternoon, 2 to 3. It will be Swasthavritta. Then there will be break 15 minutes, 3 to 3:15, because it takes time for rendering the video. And from 3:15 to we will go for 4:15. That is our usual lecture of Roga Nidan. In that way, we will steadily and slowly proceed. Thank you very much once again, and have a nice afternoon and nice evening. Thank you very much. Take care.